Hello everyone, my name is Dr. George Rapier. I'm the founder and chairman of WellMed Medical Group, which is headquartered in San Antonio, Texas. WellMed is a medical group organization operating clinics in Texas and Florida and with an extensive contracted provider network in both states. I founded WellMed 30 years ago. I've been practicing internal medicine for 40 years now. I founded WellMed with the idea of putting the patient first, of doing everything humanly possible to take care of the patient and do our utmost to practice the best evidence-based medicine possible. We've done that for 30 years, and we're doing that today. Today, I need to update everyone on the situation with COVID-19, which has become extremely urgent within the past week and which continues to worsen. The first slide, as you can see, is an alert, which was issued by authorities in Bexar County, Texas, Saturday evening. Bexar County is the largest county in the San Antonio metropolitan area. San Antonio is the 7th largest city in the United States. This emergent message is not overreaction. It is not fear-mongering. This is real. And I am not fear-mongering either. I want to present to you the facts on COVID-19 so that you can see the risk and you can make your own decisions on what your behavior should be. This slide is a chart of the number of new COVID-19 cases in the state of Texas each day. Texas started quarantining in late March or early April and quarantined for about 2 months. The number of new cases per day at that time was about 1,000. As you can see, there was never really a decrease in new cases per day in Texas. About 10 days ago, the number of new cases began increasing dramatically. Over the last several days, the number of new cases per day has been exceeding 5,000. So 3 months ago, we locked down for 2 months when we had just 1,000 new cases per day, and we now have over 5,000 new COVID cases per day. Now let me show you the active cases in Texas. These are people with active infection that we know about. In early April, when the quarantine started, there were about 10,000 known active cases in Texas. These are people who have had symptoms and have come in for testing and have tested positive with a nasal swab for the viral RNA. The actual number of infected people is much higher, as many people with COVID have few symptoms and are not tested. As you can see, the number of known infective cases is 6 times what it was in April. That means there are 6 times as many people spreading the virus around as there were in April. Now, let's look at the deaths per day in Texas. These peaked about the end of April and began declining. But about the end of May, the number of deaths per day flattened out. And now, unfortunately, in the past 2 weeks, is definitely increasing. In the past 2 weeks, we have seen a very dramatic increase in new cases per day, and we're now seeing an increase in deaths per day. And there are 6 times as many people with active known infections out there spreading the virus than there were 3 months ago. I could show you all the same graphs for Florida, but I will not. They show exactly the same pattern. Now, let me next show you the projections for what could likely happen. This graph is from Texas. Today, we have a little over 2,000 deaths related to COVID. If the current policies that are in place, that being a lack of social distancing, a lack of masks, larger events, many social events like occurred over the Memorial Day holiday, the results will be catastrophic. If these occur, the projected number of deaths in Texas by October 1st will be about 14,000. Now, many people have no symptoms, or maybe a stuffy nose or a little nasal drainage. We see many areas across the country where people are mingling, people are coming back to work, they eat lunch together in break rooms with no masks. Now let's look at the next slide. This is the case fatality rate by age. Case fatality rate is calculated by dividing the number of known deaths by the number of known infections. This is different than the infection fatality rate, which is the number of deaths due to COVID divided by the number of cases. But we can't calculate this today because we truly do not know the true number of people that have been infected. The case fatality rate in the United States is currently about 5%. That is, 5% of patients that test positive will die. The infection fatality rate is probably about 1%, but we can't be sure yet. Now let's compare that to the infection fatality rate for the common flu. The infection fatality rate for the flu is less than 0.1%, but may be as low as 0.03%. So the infection fatality rate for COVID-19 is between 15 and 30 times higher than the regular flu. That's 15 to 30 times more deadly than the regular flu. As you can see, if you're young, even below 50, and don't have other diseases, your risk of dying is low, about the same or even lower than the flu. But if you're older, particularly if you're over 80, your risk of dying if you test positive is 15 to 20%. Let's look at the next graph. This shows your risk of dying if you have an underlying disease, such as diabetes, heart disease, chronic lung disease, high blood pressure, cancer, or other chronic diseases. If you have heart disease, your risk of dying is 10 times that of a healthy person. If you have diabetes, your risk is 7 times the risk of a healthy person. Okay, now you know the facts. Many people are letting their guard down because they're tired of hearing about COVID. They're tired of being cooped up. They're tired of listening to all this on the news. Well, we may be tired of COVID, but COVID's not tired of us. After its initial brush with the United States 3 months ago, it's roaring back with a vengeance. You owe it to yourself, your fellow teammates where you work, your family, your community, and our patients to be completely responsible. If you do not show complete responsibility, you are endangering yourself and your fellow humans. If you don't do the right thing, you are putting lives at risk. You can be responsible for killing people. We at WellMed are medical professionals in the business of saving lives, not putting lives at risk. The Hippocratic Oath, which most doctors seriously take, states, first of all, do no harm. Well, if you're irresponsible, then you may well be doing harm. In San Antonio, maybe in other cities, the hospital situation is becoming dangerous. Baptist Hospital in San Antonio is out of the drug remdesivir, which is an antiviral drug to treat COVID. The Methodist Hospital system in San Antonio has enough of the drug for 58 patients. The number of people hospitalized with COVID in San Antonio has surged 700% in the past week. The number of intensive care unit patients on ventilators has doubled in the past week. In addition, the average age of hospitalized patients has dropped from 60 to 45 as more younger people are being seriously affected. So to be a responsible person, a responsible citizen, a responsible employee, a responsible human, here are the things you must do. Number 1, always wear an effective mask in public, covering your nose and your mouth. Avoid socializing with people who do not wear a mask. Do not go into stores or restaurants where employees are not wearing masks properly. Even then, spend a minimum of time with other people. Masks reduce the probability of transmission, but do not eliminate it. Number 2, do not carpool with people you do not live with. You do not know where they have been. You have no way of knowing who might be infected. And sitting in a closed car is a bad environment for spreading disease. Number 3, if you are the least bit ill with a stuffy nose, a mild headache, a little cough, do not go to work. Do not expose yourself to other people. If you have had any symptoms, check with your doctor for advice and/or testing. Number 4, stay away from high-risk people whenever possible. People over 60, people with diabetes, heart disease, lung disease, high blood pressure, cancer. Wrap those high-risk populations, the seniors and the people with chronic disease, in a cocoon. Do everything you can to help them stay home and stay safe and stay away from them. And if you have to see them or talk to them, always wear a mask and have them wear a mask. Number 5, providers, staff, and patients being cared for in clinic or hospital situations, the staff must always have full personal protective equipment, and patients should be tested and should also wear protective equipment. Number 6, if you are at work or in some other social situation, a restaurant, don't take your mask off if you're near other people. If you're at work or in a restaurant, eat alone or people you've been living with who you know are not ill. Stay at least 6 feet away from others. Make sure your area has been cleaned before and after with either alcohol or a disinfectant. And always wash your hands before and after for at least 20 seconds with soap and/or alcohol gel. Number 7, shelter at home and leave home only for essential tasks, groceries, work, with all the proper precautions and spacing. Please buy online or for delivery as much as possible. Everyone, we are not even in wave 2 of COVID-19. This is the second camel's hump of wave 1. It's critical that everyone know the facts and act responsibly. You must do all the things I listed, both for yourself and for your fellow humans. To do any less is putting yourself and others in danger. As healthcare professionals, we have a special responsibility to do the right thing for the health of ourselves and our community. But for any of us, to do any less is not just wrong. It's immoral. It's inhumane. I encourage everyone to watch this video. Please make sure that all of our employees, all the employees in your other companies, all your friends and families share and can see this video. Please share it with anyone and everyone you know. It is our responsibility to share this information and set the example for our community and our country. I know you can and you will. I know that as Americans, we will continue to do the best we can for ourselves, our families, our teammates, and our communities. Please be smart and please be careful. Thank you and God bless.